Hi everybody, I'm Morgan and I'm an addiction specialist. I've put together this video today because in this really difficult time with COVID-19 or coronavirus, many people are going to find themselves in a lot of trouble when they realize that they're dependent on opiate-based painkillers, strong painkillers that contain things like codeine and oxycodone. And they're going to realize very quickly when they can't get hold of those things, when they can't get to the chemist, or whether they're self-isolating, or where a stock has dried up, whether they've been buying those illicitly on the street or whether they've been getting them from Auntie Sue or from Grandma. So if you recognize any of these names over here, if you live in the States, things like Demerol, Vicodin, Percocet, and if you live in the UK, more like codeine, co-cdamol, tramadol, and then the names oxycodone, oxynorm, buprenorphine, morphine, methadone. All of these are opiate-based painkillers derived from the poppy plant, and not that far off, but weaker versions of things like opium and, yes, heroin. Some of them are natural, some of them are man-made or synthetic, but they all work in a sort of a similar way. So a lot of people end up with a situation where they might have had a car accident or some kind of surgery or an operation and get on really strong painkillers and realize that, wow, these actually make me feel really good. And there's a good reason for that, so I'm going to try and explain. This oversimplified diagram, which looks a bit like an elephant's foot, is actually my take on an opiate receptor. So in your brain, you have the end of all your nerve cells, you have these receptors where different items or different molecules can bind to the nerve and cause a reaction. Now, one of the things that nerves can and do bind with is something called endorphins. We all know what endorphins are. So you've got this little smiley face, happy mood chemical called an endorphin. This is what you get when you laugh with your friends, when you've just done something that you're really proud of and you feel euphoric and you feel great. You get the release of these endorphins in your bloodstream, which would be running past your nerves. When one of these endorphins goes and sits on this little receptor over there, it sends a message up to the brain that creates sort of a euphoric atmosphere or a good feeling. Now, unfortunately, the other drugs that I just mentioned before, the body seems to think that they are the same as endorphins, so they may look a little bit like that or a little bit like that. So as you can see, they'll fit perfectly in that little receptor in the nerve, and they will also create a response. The handy thing is that these are much stronger than normal endorphins. So when you have to work really hard in the gym to get the release of endorphins, it's much easier just to take a tablet because it makes you feel better. And I'm going to explain exactly why. In our bloodstream, we all have something called noradrenaline if you're British, or norepinephrine if you're American. They're the same thing, just different names. Why we could never agree on these names, I don't know. But anyway, that's where we are. So when you have a lot of these in your bloodstream, it makes you feel anxious. It makes you feel nervous. It makes you feel that horrible feeling in the pit of your stomach that you get when you're really nervous. You can get things like diarrhea. You can get things like the shakes. And the more of that you've got in your bloodstream, the more you feel like that. What opiates do is they send a message to the brain to stop producing noradrenaline or norepinephrine. So the stronger the message, the bigger the blockage of noradrenaline or norepinephrine in your bloodstream, and as a result, you start to feel much better. You sleep better, you're much more relaxed because you're artificially getting rid of all of these substances in your body. Of course, there are other endorphins or neurotransmitters or mood chemicals, but specifically when we're talking about opiates, it's these two, two different names. Unfortunately, what happens is when you're sending this message to your brain, the noradrenaline is still being produced and it's all above this blockage. It's in its storage, it's all fine. But the minute that you don't have these on your receptors, you stop the message and that blockage is opened and all the noradrenaline floods back into your bloodstream. So when you're in the situation when you use these drugs every single day, the body actually adjusts and it can actually start to function quite normally, regulating the amount of noradrenaline that comes through every day, but not regulating it in a natural way, kind of like a almost like an induced regulation. So you can function almost as well and normally on these medications, providing you're not taking massive amounts, than you would in normal day-to-day life. And that's how people can go on taking more and more and more of these substances as the body gets used to them. But what you then do is you take some when you need it and you want to feel better. So anytime there's a stress, when you want to sleep, anything like that, and your body actually becomes almost run by the routine of you taking medication. And that brings with it a whole host of psychological problems, which you will need to deal with at some stage. But right now, we're just talking about the physical detox process. So what happens is, because your nerve has now become normal, when you stop taking your normal daily dose, either because you go too long between doses or you run out of medication, like may well happen now that we're all self-isolating, we can't get hold of stocks, this opiate is going to drop off the receptor. That message is going to get broken down, and all that noradrenaline is going to get released into your system, and that's going to cause massive withdrawal. Now, we know that your body tends to try and restore everything to normal, and in the same way that it adjusted to become used to these drugs when you're dependent on them, it can again become normal, but it takes a little bit of time and you're going to have to go through withdrawal. Withdrawal syndrome is characterized by things like nausea, as I said earlier, stomach cramps, diarrhea, insomnia, restlessness, agitation. And if you suffer from any mental health problems like depression or anything like that, it just amplifies them and makes them much, much worse. The good news is this only lasts for a few days, because like anything in life, nature always tries to return to its normal state. So if you plant a lovely garden and you leave it, within weeks there's going to be weeds and all sorts of things that you don't want there. The body's exactly the same. So because your nerves have now changed to be able to accommodate these drugs and function normally in the presence of these drugs, right, it needs to return to normal. And that will happen pretty quickly, within about 4 to 5 days at the peak of that. And then afterwards, for a week or two, you might still have some of these symptoms. It's really important to remember that just because you feel normal, you are likely to be at least slightly sedated, and you cannot really function at your best when you're dependent on opiates. You might think you're getting away with it, but the people around you have probably noticed that something is wrong. So what I've done is I've come up with a list of medications, most of them over the counter, that we regularly prescribe to patients or advise patients to get hold of to help them. Now, I must say, I can't prescribe to everybody over a video, because obviously everybody's different and everybody's got their own unique medical problems. So please seek medical advice before you take any of these. But these are just general guidelines to help you through things. And all of these drugs that I have recommended should be available without prescription, except one, which is the ones for nausea. But the best thing you could do is, if you can contact your physician or your doctor, that would be your first step, or even your local pharmacist can be really useful, just to say, this is what's happening to me, this is what I'm going through, can you help me with something, please? So sometimes for stomach cramps, we use things like Buscopan or Bentyl in the US, or something called Mebeverine. For nausea, metoclopramide, that's the one that you would need with a prescription. It's called Maxilon or Reglan. For aches and pains, anything like paracetamol, or if you're American, acetaminophen, things like Tylenol or ibuprofen, called Nurofen or Advil. You should be familiar with those. Those will just help with general aches and pains. Diarrhea is another symptom you get. We all know Imodium. You can use that fairly safely. And then the one thing that generally gets to people is the sleep. And there are ways you can get around that, but the reality is you're probably not going to sleep well for a few days while you're in this withdrawal phase. One of the things you can use is mindfulness or meditation. And if you're after something like a guided meditation, YouTube is full of them. You can just go in and search for relaxation meditation or sleep meditation or something like that. It's not going to turn your body off, but what it is going to do is just help you to relax and get through things. Medication, you might again want to ask your chemist if they can, or your pharmacist if they can prescribe something, again, or your doctor. There are some over-the-counter type remedies that you can use, but I wouldn't advise using any of them without medical advice, because everybody's medical circumstances are unique. One of the other things people really struggle with is leg cramps. It feels like your bones are cramping. And a good way to do that is to try and walk it off. Nice hot bath in the evening before you go to bed. And just remember that this syndrome of withdrawal, while your nerve is trying to get back to normal, is only going to last a few days, and it won't kill you. There have been very few recorded deaths of people who've died of opiate withdrawal, but it's going to feel like it wants to kill you. So get your family and friends and your loved ones close to you to just be as supportive as they can. Try and be positive. Get some medication if you can to help you through it, and know that the end is in sight. By far the best way of getting through this process is by reducing your dose slowly over a period of time. That allows the nerves to change gradually and makes the process much less intense. So you'll still have withdrawal, you'll still have a milder version of all these symptoms, but you won't have that massive, what they call cold turkey. So I would recommend you reduce your dose by about 10% of your total dose every week over about a 10-week period, and you'll find that the last 2 weeks might be difficult, but early on you're going to sail through it. Please remember that if you're affected by any of these issues, that help is at hand. There are drug treatment services in virtually every city and every town. All you have to do is get onto Google and look for them, or get in touch with your local doctor, local support groups. There are telephonic services that can support you over the phone, and places that you can walk into. Maybe not while we're all in self-isolation with the virus, but certainly you should be able to get hold of somebody on the phone who'd be able to help you. You're never going to be on your own. If you want to reach out to me, you can find me on my Facebook page, Dr. Morgan, or go onto YouTube and search for Dr. Morgan, or Dr. Morgan, the doctor in a tube, and you can see 1 or 2 other videos that I've already posted, and I plan to do a few more. So feel free to like this video. Please share it with anybody if you think that it would benefit, and if you haven't already, hit subscribe. I'd love to see you again soon in the next video. Keep well. See you then.